we did not want to go into crisis standard of care.
Idaho continues to break records when it comes to local cases and hospitalizations. Now doctors are giving troubling new data as Governor Brad Little visits the Panhandle today.
I've been told that there has been over 2,000 surgeries that have been prevented or stopped because we don't have room for these surgeries.
Now, for the first time since the pandemic began, both states' governors are in the inland Northwest to discuss our healthcare systems. And they're leaving our region with one message: get vaccinated.
In weather, we are tracking warmer weather on Thursday, but continued windy. We've also got sunshine in the forecast over the weekend. All your details are coming up next.
Good evening, and thank you for joining us for KREM2 News at 5 tonight. I'm Mark Hanrahan.
And I'm Tom Sherry. Whitney's on assignment. Well, for the first time since the pandemic began, both Idaho and Washington governors are here in the inland Northwest. Both had the same messages: get vaccinated to end the pandemic.
We have team coverage of both governors' visits tonight. We'll start with KREM2's Amanda Rowley in Spokane, where Governor Gov Inslee visited Providence Sacred Heart today. Good evening, Amanda.
Good evening. Here in Spokane, all Providence and multi-care hospitals put a pause on elective surgeries, and that's because of the surge in COVID-19 hospitalizations. Governor Inslee says he was frustrated to learn just how impacted these elective surgeries have been because of the surge. Now take a listen to this. Providence Health, Sacred Heart, and Holy Family hospitals have postponed 2,000 surgeries. Inslee says these are women with breast cancer, people with brain tumors, and people with cardiac problems who are desperately waiting to have their procedures.
So we have 2,000 people in Spokane County today who haven't been able to get their cancer treated, for goodness sakes, because we have other thousands of people in Spokane County who haven't been willing to get this vaccine. That's very discouraging, and it needs to change.
Now, we confirmed also with multi-care, Deaconess and Valley Hospitals, they have postponed 1,800 elective surgeries since August. That's about 3,800 total surgeries in Spokane County. Now, Inslee went on to say not getting vaccinated is a threat. Everyone in Spokane County is a threat to everyone in Spokane County if you never get COVID, even with that situation. Now, as for the situation in Idaho, Governor Inslee says they're obviously dealing with a crisis standard of care operations at those hospitals. He says he supports helping our neighbors, but he is frustrated that Idaho's elected leaders are not encouraging vaccinations more. Reporting in Spokane tonight, Amanda Rowley, KREM2 News.
Governor Brad Little also visited Coeur d'Alene today. Now, while there, he visited the monoclonal antibody treatment site at the Kootenai County Fairgrounds, run by Heritage Health.
This comes as Kootenai Health leaders say they are seeing the highest number of deaths due to COVID since the start of the pandemic. KREM2's Ian Smay is live at Kootenai Health tonight with more on that. Ian?
Mark, Tom, the aim of the monoclonal antibody treatments is to keep people out of the already strained hospitals here in North Idaho. The treatment uses lab-made antibodies to help your body's immune response in a fight against COVID-19. Today, Kootenai Health leaders painted a grim picture of the COVID crisis. Kootenai Health is still feeling the strain of the COVID-19 surge. As of today, doctors are treating 115 COVID-19 patients, with 41 of them in critical care and 17 on ventilators. This marks more than 2 weeks of more than 110 COVID-19 patients at Kootenai Health.
I think that, to me, I never thought we would get to this point to where we had this many COVID patients in an ICU setting when we thought about these plans over a year ago.
With a high positivity rate sitting at about 25%, Dr. Robert Scogan said he expects hospitalizations to remain high. Doctors are also reporting more cases of severe illness from COVID-19. This surge has also led to more deaths, with leaders reporting 34 deaths from COVID this month. Doctors are also reporting more deaths in young people.
Very disheartening, very surprising. I'm trying to choose the right word. I've signed a lot of death certificates in the last couple months, and a lot of death certificates of young people that I don't think should have been hospitalized. I think that this in my mind is a very preventable disease.
Patients are still being treated in non-traditional areas, and the federal resources that have been deployed to Kootenai Health will stay until at least November. The monoclonal antibody treatment site at the Kootenai County Fairgrounds can handle 6 patients at a time and up to 48 a day. That allows Kootenai Health to shut down its monoclonal treatment center in order to free up more resources for hospitalized patients. Governor Brad Little visited the site at the fairgrounds this morning.
If you get into a bad car wreck or you have a heart attack, you're going to get care, but it's close right now. What you're not going to get is the elective or discretionary surgery that's necessary, and we just can't do that for very long, and that's why what Heritage is doing up here is so important.
With more young people dying and high patient capacities continuing, it's been hard on local healthcare workers.
They're patients that we get to know. They do spend many days in the ICU, and we do everything we can to get them better and get them out, but unfortunately, as we've learned with COVID, that sometimes we are unsuccessful in that.
Little also said during his visit today that while the monoclonal antibody treatments have been successful in keeping people out of the hospital, the key to getting out of the current surge is for more people to get vaccinated. He also said that he believes that things such as mask mandates or vaccine mandates should come from local governments or health districts, because if it comes from a more local group, more people will be likely to follow it. Reporting in Coeur d'Alene tonight, Ian Smay, KREM2 News.
All right, Ian, thank you very much. Well, we are quickly approaching the last day that Washington State employees can get vaccinated under the governor's deadline. Right now, state employees, teachers, and healthcare workers can only get the single-dose Johnson & Johnson vaccine in order to be vaccinated on time. You have until October 4th to get the shot to meet that deadline of October 18th. According to the latest data from the state's Office of Financial Management, the vaccination rate among state employees jumped nearly 20% between September 6th and the 20th. As for exemptions, so far 5,700 people have applied for exemptions, and less than half of those have been granted. We spoke to one woman who got a religious exemption, but she found out she'd likely lose her job because the state could not place her in a non-public position.
To me, I don't feel like I need the vaccine. I feel like God is protecting me from this, and He will continue to protect me from this. And I shouldn't have to be forced to put something into my body that I don't believe in.
A spokesperson with Governor Inslee confirms even if exempt employees can be fired, if an agency cannot make accommodations to keep those employees from interacting with the public.
Well, with the federal government shutdown looming, critical services in our state could be disrupted. But would a shutdown interrupt our state's COVID response? The Washington Department of Health tackled that question today.
The majority of our public health work and certainly our response work here in Washington would continue forward. As state employees, we have flexibility, in most of our programs to do that work because the funding comes to us in the form of grants.
So we could lose some federal employees who become unavailable in the event of a shutdown, but many healthcare workers would be exempt.
Well, our very own Whitney Ward has been on assignment the past couple of days. She was in Moses Lake visiting an ICU overwhelmed by COVID patients. That story will air tomorrow night right here on KREM2, but tonight she is giving us a sneak peek.
It's like you're falling down a well and there's no place to grab a hold of.
I think that they're just getting more and more kind of tired and maybe a little bit frustration.
What do you think is fueling some of that frustration?
The fact that every day they come to work and it's just as demanding as it was the day before.
And then we have people in our community doubting our abilities, our word, and that we are somehow deceiving them about what's really happening inside these walls.
Were you worried coming to the hospital?
Yes.
What did you worry about?
That it was going to keep getting worse and worse, and I'm going to be one of those that they flip-flop and it ain't going to work and I'm going to die.
Well, make sure to join us tomorrow night right here on KREM2 for that report. Now, we know this is a lot of information, so for the very latest, just check KREM.com or text us the word COVID to 509-448-2000.
Yeah, and don't forget about the KREM2 app. Keep up with the latest breaking news updates. It's free and it's in your phone's app store.
All right, let's switch gears for a bit, shall we, to talk weather, because it's been an interesting week, Tom. We had rain a couple of nights ago, and it's been a bit cooler, including today, right?
Yeah, after a beautiful weekend. Let's remember last
80
weekend.
degrees.
Yeah, well, we're going to get a nice one coming up as well. We're at 58 degrees right now. You can see the wind is out of the south at 7 miles per hour. Rain on the west side of the state. A little bit of shower activity now just to the west of the Moses Lake area. We think we'll see rain here in eastern Washington, like real rain tomorrow night. Look for mostly clear skies. skies overnight with a low of about 44. We'll see 70 tomorrow. And again, the rain starting, we think right now, after about 9 in the evening. For the weekend, I've got partly cloudy skies Saturday and Sunday. Mild on Saturday with a high of 69 and warm on Sunday with a daytime high of 73. I'll check the rest of that 7-day outlook coming up in just a couple of minutes.
Sounds good, Tom. Thank you very much. And still to come tonight, the biggest question of the past nearly 2 years: when will the pandemic finally be over? And what are the qualifying metrics to determine when it's over or if it's over? Our Verified team looks into that coming up.